We are talking today with Dr. Bree
Hi.
and Dr. Briana Bender, who is a chiropractor in Daytona Beach. And we are talking about how emotions are stored in the body and how trapped emotions disrupt the communication between the brain and hormones and the immune system. And that's what my work looks at. We have multiple different practices and modalities that are looking at this from various standpoints. And neuroemotional technique is what Dr. Bree uses. And so today we're going to, compare notes and talk about how we see emotions being trapped in the body. And we were talking a few weeks ago specifically about how men and women express and hold and store emotions differently, and how all of this leads to physical symptoms. And
Absolutely.
welcome, Dr.
Yeah, thank you for having me. I'm so excited. So, yes, our conversation was really interesting, just like comparing our clinical notes of what we see just in this collective of patients that we interact with males and females. And I feel like, maybe it's a societal pressure that people have to kind of feel a certain way or act a certain way, or if they're not feeling the way that they feel like they're supposed to feel, they'll suppress the feelings that they have. And that's really where we start getting in trouble because if those emotions are unprocessed, I mean, emotions are normal. Emotions are great. You use them to kind of help you make decisions. You don't let them overrun your life. But if you don't accept them and process through them, that's when they get deposited into the tissue and cause a bunch of problems. So,
Yeah, it's true. No, emotions we are experiencing all day long, and it's important to feel our emotions. And so what we're talking about is what happens when we're not feeling those emotions, or like
mhm,
not processing or being conscious with our emotional body, which is, oh, by the way, something we don't learn and kind of have to figure out as we go through life. And then we develop all these health problems as a result of not having this figured out. And along comes neuroemotional technique, which
mhm,
is an incredible practice that I've experienced a lot in my health journey through kinesiology and working with different private chiropractors, and practitioners that use this. Um, and it is basically like you can share how this tool works for identifying emotions trapped
mhm,
in the body and releasing them. And
mhm.
yeah.
Yeah, so what I love about it, and I came upon it the same way as you as a patient. I've had friends and colleagues that I've deeply respected over the years, that have utilized it, and for me, I was kind of like, oh, it's a little, I don't know. It was just I didn't really understand it, and so I kind of steered away. But I utilized it one time with a friend, and um, basically changed my whole life. I mean, I was doing all the things that I knew. I was in a really stressful situation. I had dozens of symptoms, and doing all the things though, all the supplements, all the neuroregulation, all the chiropractic stuff. Um, and I was still symptomatic. So any adding neuroemotional technique into that is really what was the secret hidden key for me. But so basically, NET uses a muscle test as a biofeedback tool, like you would in your kinesiology practices. And so, what I love it about it and what makes it very unique is that you don't have to come with a story. You don't have to come with, like, okay, I think my issue, like you would to a mental health therapist, which I love mental health therapy. And I think, especially if it's not super traditional, that it's very effective. But you come to that with kind of a story, like what's going on in your life. With NET, you don't need a story because a lot of the stuff that's being driven in the body is through the limbic system. So you're communicating with a part of your brain that doesn't really make sense. It's on the other than conscious side. And so a lot of times people going through the technique, they're like, oh my gosh, I never would have put that together. You could sit in therapy for 10 years and not figure some of this stuff out because it's not a cognitive, conscious, logical thing. It's that deep that we always talk about, this deep nervous system threat. I had a patient one time that was in a car accident while he was eating an ice cream, and the nervous system was like, "Oh, dairy is a threat to your survival." It's very nonsensical, but that's just the way he was not able to consume any dairy because of that threat. So through the NET, now he's able to eat dairy again, because you're just linking up that prefrontal cortex into the limbic system and shutting that off. Like that's not a threat to your survival. You're not going to die if you have an ice cream. So but you use that as a biofeedback tool, the muscle test, and you can come in with any body complaint, like say your knee hurt. All you do is contact the knee, check and see if there's an emotional component to it, and then the technique just takes off and it will tell you what emotion is stuck in that tissue and it will also release that. So just knowing that emotions are physical, actual physical substances, and they're neuropeptides. They're very, very small substances that can get deposited in the tissue. And so being able to release those, I mean, it happens all the time. Um, just 3 or 4 weeks ago, I had someone come in with this knee pain, go through it. They're like, "What? That's stuck in my knee." I'm like, doesn't make any sense logically. But then she's had knee pain for 9 years, went out and just walked 4 miles without knee pain whatsoever. So, it's just crazy. And granted, there are structural components, there are biochemical components, but adding the emotional component to that is just it's transformative. And I think we need them all. They all need to at least be checked. But that's I don't know if I'm doing a good job describing what NET is, but using the muscle test to find out what emotion needs to be released or processed is how you get rid of these really chronic, annoying, like not understandable. Hear patients all the time saying, well, my heart was doing this weird thing. I went to the ER. I thought I was having a heart attack. I was having all these issues, um, I went to a cardiologist. I saw that everything's fine. Everything's perfect. All my labs are perfect. My EKG is perfect. Everything's great in this medical world, but you're still experiencing symptoms. You can't get rid of it. Nobody can understand it. So it's just a different way of approaching. And like you said, linking up, just getting rid of that disruption and linking up the different parts of your brain and nervous system so that you can just be yourself and not have these chronic symptoms.
That's beautiful. Yes. It's so true, that the emotional body is where a lot of the illness can
Mhm,
be rooted in or stored, um,
mhm.
and causing stress, like you gave that cool example of the knee. That's an amazing story,
It's
and,
just
like yeah, it can be stored anywhere. It can be stored in the liver, it can be stored in the heart,
absolutely.
which is a hugely expansive energy, um
Mhm,
and we can kinda try to get into talking about that because the topic of our talk is, releasing emotional armor, and
mhm.
so much of that like, when we were talking about genders and
Yeah.
specifically, and, um, like, I have a lot of one I just notice a lot of this in my practice, like, specific to gender, and you can speak more to, like, your experience, but, like,
Mhm.
for
Mhm.
example, I'll notice women having a lot of trapped anger. I don't
Absolutely.
use NET, I use, like, bioresonance scanning and some other various different emotional release techniques based on muscle
Mhm,
testing, that
mhm.
I've acquired throughout the years, and but anger is something that is kind of stagnated a lot in, women, uh,
Absolutely.
and if you think about, like, the societal pressures of, like, not expressing anger, like, there's not really a way to a lot of women have to express it. It's taught, you know, not to be expressed. And so it gets trapped in the body, and
Mhm.
it gets trapped like Chinese medicine is where a lot of this connection to
Yes.
organs and the emotions comes in.
Mhm.
and it gets trapped in the liver often, and the livers are a huge detoxifier. It's like
Yeah, absolutely.
a huge and so detoxification kinda gets impaired if the a lot
Mhm.
of the liver energy is not flowing, and that leads to all kinds of health issues from there when it comes to, like, hormone imbalance or blood sugar regulation and weight management, um, and all of
Absolutely. Absolutely. Yeah, I'll even find anger as an emotion. Like that's one of the emotions in the NET technique. And so we'll be talking, a few sentences about a story, and then I'll find that the patient has anger. And I'll say, okay, can you put anger, in with this scenario that you're describing? And they're just like, no. I mean, it could be even something like, infidelity. And I'm like, "So there's anger. Can you put anger in there, with the infidelity with your partner?" And they're just like, "No, not really." Like, I feel like hurt. I feel, it hurts my feelings. I feel like, and maybe I get like irritated that it happened, but they can't even connect. Like when I'm saying, this is what the technique is showing that there's anger, and they're just like, no. And I'm like, okay, you've gotta try to find the anger somewhere and to release it. And so I'll make them feel it for 30 to 60 seconds, but it's very difficult to even, get them to go to that place where they can feel angry about something that would be justifiably, like, valid to feel. And so that's how much suppression is going on. And wow, is it powerful when you acknowledge it and just say, "Yeah, that makes me so angry." Yes,
you
it
nailed
does.
it.
It's so
Yeah.
good. Be angry. You don't have to act inappropriately or hurt other people or hurt yourself, but it is okay to be angry. And once you release that and you can, connect to it, oh my gosh, it changes your whole life.
Yeah, it's like you're opening a channel and
Absolutely.
for flow in your body, and you just, like, described perfectly the interaction with the
Yep.
kind of person that I find this in too. That's like there's no recognition of anger, and you would never guess, like, there's any anger, and it's very palpable when you access it through muscle testing. It's the first it's, like, very
Absolutely.
but,
Yeah.
yeah, it's what it's doing instead of expressing is hurting the person, being up
Absolutely. And I don't feel like that is a well-known fact. I feel like people just accept these things as just, yeah, most people have stress, most people have symptoms. That's just kind of what the life is. They don't know that they don't have to live like that, and that they don't have to suppress everything. They just really think they're doing a good job, and like this is the way my life is, and they're ending up with all these chronic symptoms. And I just feel like it's a huge mission that we have, in our realm, to educate people. Like, you don't have to live like that. Like, it's okay to be authentic, to be yourself, and to feel whatever you're feeling. Because if you don't, um, there's another example that I have. This friend of mine she's done NET for many years. She's an NET practitioner, and she got into this argument with her spouse, and she basically, like, without going into the details, she basically, like, lost it. She, like, threw pillows and was like, "Oh my gosh, if you do this again," like, it was, kind of in the addiction world. She's like, "If you do this again, like, this is over," like, lost it. And she's like, "I cannot believe that that's never come up in NET before, because that was such a traumatic, like, experience and conversation. It was so fueled by just a lot of anger and a lot of fear and a lot of things." And she's like, "I'm just shocked that it's never come up in NET." And I was like, "Why are you shocked? There was nothing to store there. You got it all out. You expressed exactly how you felt. There was no like, okay, let me go suppress this for the next 10 years and then here it comes back up. Like remembering that. Like you got it all out. Like so not that I'm recommending we throw pillows and scream, but sometimes, it's much healthier to do that than it is to just pretend like it's all fine and um keep it.
I do actually recommend people go before I knew
Yeah.
about NET and some of
Uh-huh.
this, would recommend people throw pillows
Oh, I
and
think there is a time and a place for it. Absolutely. Absolutely.
maybe by yourself and, like, yeah, like, just
No,
get body energy out of the body. Uh,
absolutely.
but yeah, that's now it's interesting, like, to talk about anger and repression in women because
Mhm.
I see it just so
I do too.
loud and so common and so frequently.
Yeah.
And been having this interesting conversation about around autoimmunity lately, and you can
Mhm.
just imagine like the energy of like the body turning against itself
Yep.
if anger isn't expressed. And that's, we do see a lot more common autoimmunity in women. Not saying here,
Absolutely.
it's everyone's angry, but maybe there's a thread there. But what is going on in men where we see something not expressed? Like, is there any common thread?
Yeah, I feel like men, they're kind of the opposite. Like it's sort of societally acceptable for men to be kind of this macho, like angry, like don't mess with me, don't mess with my family, like whatever. So where they have a problem expressing is like sadness or grief or crying or sometimes having a really hard time connecting to like, yeah, that hurts me. Like hurt my feelings. I'm sad about that. Um I had this client a few months ago. Um, he was an ex-military um, person and never since he's been out of the military 19 years, he hasn't been able to sleep for longer than 3 hours at a time. And even that was a really good chunk of sleep for him for 3 hours. Um, And that didn't happen on consecutive nights. So he'd get 3 hours, on Monday and then, just kind of up and down the rest of the night. And then maybe on Friday, he'd get another 3-hour chunk. So you can imagine you're not able to sleep. Um, that affects everything in your physiology. It affects everything in your mental world, your physical world. We did some NET, and basically it came back to, like, he's gotta be this protector. He's gotta be the strong one. He's gotta take on all the burden for everybody around him, his squad in the military, his family, all of his friends. He's got to attract all of the burden and take it on himself because he's that strong person. And it's like, you know, it's okay to be vulnerable. It's okay to be sad. It's okay to cry, for a man. And in fact, like, that male energy, like, really when you reframe, like, what a really healthy, like, symptom-free male looks like with a strong, physical body, a strong relationship life, strong business life, they're very well-rounded emotionally. But just in society, I feel like men kinda shy away from feeling sad or soft or even expressing grief. They just kind of, no, it's fine. We're good. Let's just keep it moving. And so the way it manifested with him was with his sleep. So after we did the NET, I mean, he was shocked. And this was um several months ago. He's slept many hours every single night since it happened, since the NET. So it's just looking at that emotional piece and reshape your entire health.
Yeah, I imagine like, yeah, like the heart, the lungs, the
Oh, absolutely.
these, but a lot
Like
of people
you said,
struggle.
the hormones, the cholesterol, everything is just you're setting yourself up for all of these chronic um diseases because it's not something that's going to go away. It's not something that can go away on its own. It has to be recognized with a technique to be released. So, very powerful, very anti-inflammatory. I mean, just talking about that nervous system threat of like you haven't processed this emotion and your body feels like in a constant state. I know we all talk about it, but your safety is threatened. So what's going to happen? Like you just mentioned, you're going to have an elevated blood sugar because you want to have energy to fight against a threat. You want to have elevated blood pressure so that you have the ability to run. You're going to um have increased cholesterol. You're going to have you're just going to go through all of this like very very inflammatory cortisol, adrenaline. You can't outrun a nervous system threat.
Yeah, we're talking about what prevents the nervous system from fully relaxing, coming back to like that zero, like,
Yeah.
center, and that's where the body heals. That's where the bodies can repair and detox and restore. And if that's not happening, if you're not sleeping, which is when that happens,
Yeah.
yeah, you're just building more and more stress, and okay, eventually something's going to break. And
Absolutely. And that's when people come see us, huh?
that's when people come see us, because
Like,
before,
come before that. You can come in before you're having a health crisis.
I think that's why we're trying to have these conversations, so we can
100%.
be get people to be more proactive and
Yeah.
because people are looking for this. They're looking for that
Yeah.
emotional release. The emotions are stored in the body. They're not stored in the mind, or to think about, but they can be released from the
Mhm.
body. And NET is one of the modalities that does it, but it's also has there's a lot of pretty good medical evidence at this point and
Mhm.
research on NET and health outcomes and reducing.
Absolutely. Yeah, we did, the foundation that does the NET research is called the One Foundation, and their research is cutting edge, groundbreaking in the mind body world, and it's very interesting to see, they've done research on some different physical conditions, but also mental, just post-traumatic stress type of things that are running through, the anxiety, depression kind of world. But one of the most interesting studies, well, there's a lot of interesting ones, but one of the most interesting ones is this study they did on low back pain. And me being as a chiropractor, I don't adjust people for money anymore. I just do this emotional work with NET. But and low back pain has never, like, just to be honest, like, low back pain has never been like what's gotten me out of bed in the morning. Like, oh yeah, I'm gonna go fix some low backs up. And some people really do get into that, and I'm really grateful for them because low back pain's really annoying and it affects everything about your life. But just for me personally, I've not been like, okay, low back pain is really something that I have a passion for treating. However, the NET study on low back pain was so amazing because they did a lot of biomarkers in the lab work and they tracked some of these things that we're talking about. They're tracking interleukins, like how this is affecting the immune system. They were tracking, the A1C, the I believe that they did the C-reactive protein, just checking inflammatory markers, um, checking cholesterol levels. So all of these lab findings that we're used to looking at every day and saying, okay, we have to have like a medicine to change these numbers. No, absolutely not. All they did was NET with this low back treatment, and they weren't even doing chiropractic care. They were just doing NET for low back pain. And all of those things normalized and got better and better and better and better and better, even out 12 months. And that is just dealing with this emotional side, nothing else. It's just absolutely fascinating to me how powerful, just the mind body connection is. Honestly, I think we all discount how powerful that is. And
We
that's
should all be doing this, like, every week, because the more emotions we can release, the more stress we are releasing from our stored stress from our system, so we can stay younger longer and more able and, like, more vitality. It translates directly to more vitality, and
absolutely, who doesn't want that?
yes, and it's like, we get ma it the self-care is
Hmm.
getting massages for your. Um, this is more than self-care, though. This is an active part of our health. Trapped emotions have a measurable out or impact on our health. And
Absolutely.
um, I make
Yeah, absolutely.
I make my coaching students watch the documentary Stressed, which features.
Perfect.
You can watch it on YouTube. You can watch Stressed, the documentary on YouTube, and it features NET, how it was
Mhm,
created, and by somebody that was simply not satisfied and not seeing,
mhm,
adjustments hold, and
mhm,
like a chiropractor not seeing things hold, and symptoms not
mhm.
re permanently be released from the body until there was this emotional attention. Um,
Absolutely. I mean, I think that that's what we're all chasing is a root cause, at least in our world. Um, if you can address the root cause of the symptom. What's back behind driving this and driving that? Like, should you really need to take a medication for the rest of your life every single day? If that was getting to the cause, then no. I mean, you shouldn't have to do that all the time. And
We
so
sorry.
I feel like that, yeah, I just feel like that's really important to seek out what is actually causing this. Um, and not just managing it or putting a band-aid on it. I mean, we all need like reinforcement and we all need to get that connection because we live in such a, you know, high stress society. I think it is important to, be proactive and have these I don't really like the word maintenance, but you do need to maintain your health actively. But if you're still symptomatic and you're just patching that, I mean, that's I kind of got into this, you know, um, issue with my own health doing neuroregulation stuff because I was like, oh, I need to get in that parasympathetic mode, but I'd be doing, 30 different things each day just to keep my body at somewhat of a baseline. And at that point, it's like, that's not really getting you where you need to go. That's just another band aid. And so I see people doing that in the natural, like holistic world too. Just kind of, okay, well, I've got to do this morning, noon, night, several times throughout the day to just kind of do this. And to me, I'm like, okay, there's got to be something behind that if you need to do it that much.
When you like, when we go to the doctor, it's like sometimes we leave feeling more stressed out and more unempowered. And the
Oh
way you
gosh.
feel after a NET session, releasing these emotions and the equivocal like weight that is released. I mean, it's like I could feel so like I could float up into the space. I feel so light and it's like we're practitioners that are looking for the root cause, as you said,
Mm-hmm.
and the root cause can be a few different like
Mm-hmm.
general categories:
Mm-hmm.
the structural body, the like the chemical
Mm-hmm.
exposures and things like that. But it's no mystery. It is not this like hidden science or hidden fact. It is shown that emotions like contribute to like 80% of health conditions. It's like there's
It's
research on it. Like it's a known. And so that but there aren't solutions
right.
our mainstream.
No.
The solutions are these modalities that can find the emotion that is stored where and why and facilitate the release through I don't know. Can you describe how it happens?
How the release happens?
I mean,
Um, Is that what you're asking me?
yeah. I mean, I can attempt to.
Yeah, so I fully believe that as many times as I've explained this to people, like the technique itself, and I do have some um content that it doesn't have audio, but there is some content on my socials of me doing the technique with people. Um, but overall, like I feel like it's something to be experienced, rather than something that can be well described. Because the treatment itself is very elegant, it's very gentle. And I mean, I've even had people come in and say, like I did have this low back pain guy come in one time and chronic low back pain for like 25 years, does everything, does all the things. That's how I know it's emotional generally. They're doing the acupuncture, the chiropractic, the yoga, the stretching, the exercises, the ice, the supplements. They're doing everything and they're still having this issue every single day. And I'm like, well, you're missing one little thing. Like you just said, 80% of your symptoms may be coming from this. So I do the treatment. So the treatment is you use these meridian access points along the wrist. You can use those to kind of find what emotion it is, or you can use the organs. So you can use like the lung points, adrenal, thyroid, heart. You can do liver, spleen, gallbladder, kidneys, all those different points, intestines, uterus, prostate. They all have different points on the body that you can find. So you can correct or find and correct from the wrist meridian access points or from the body meridian access points. You can also correct them with the wrist, or you can correct them with a spinal, basically a bilateral facet tap through the spine. There's different, they're called Riddler sequences. And so you're just tapping on different segments of the spine in order to like get this to process and release. But you're utilizing these 2 points on your forehead. They're right above your pupils. They're your emotional points. And so you're contacting those. You're contacting this point on your wrist. And so the treatment is kind of like, okay, you're doing this. And then what you're doing mentally is you're holding a snapshot of the story that we created. So what NET does is that it's not mental health therapy. And that's why I have a license to do this, because I'm not talking you through a problem and trying to give you coping strategies or trying to do cognitive behavioral therapy or anything like that. But you are holding a snapshot of something, that's going on in your life, or that had gone in your life. And so you're addressing the physiology of the emotion. And so rather than that cognitive psychology piece, you're addressing like, I want people to get that feeling and that physiology, like, you know, that that really did hurt me when my mom told me that when I was 12 years old, when she told me I was too fat to wear my bathing suit at the pool. That physiology that flushes on you. Like that is what we're getting rid of by linking up this frontal cortex and the limbic system. Like that was such a threat. So what you're doing is you're holding that in your mind, like that painful piece. But it's like 30 seconds. It's not like you're spending an hour talking about this and going over it and like digging yourself into a deeper pit with it. You're sitting there, you're thinking about it for 30 to 60 seconds, taking these really big deep breaths. So you're holding this mental snapshot with these physical points, getting access to the energy of that meridian. And what you notice, and people will notice this every time, it's a little bit different, but people will notice, like, and I'll tell them, okay, so here's the treatment. When you're thinking about this, you'll start out just really like, this is bothering me so bad. And then just keep taking these breaths, and then all of a sudden it'll feel like it shifts, or it's lighter, or it's lifted, or like you're thinking about what you need to buy at Target later. you know, you just can't really connect to it anymore. And that's when you know that the treatment has completed. But watching it from the outside, you're just like, wait, you just tap their spine, or they just have this contact point, like what is happening. So it's really powerful that we do have these functional MRI studies um that can show the resources being redistributed to different parts of your neurology. Because the technique, I mean, it's very, if you don't feel it, it looks very like that looks pretty simple and pretty easy. Am I right? Like it, when you see it from the outside, you're just kind of like, what just happened here? But
Yeah.
feeling it and experiencing it, you're just like, oh, okay, now I get it. And what's really powerful is not that this always happens, but what's really powerful is if you come in with a body problem and that body problem instantly goes away. You stand up and it's like, wait, well, where was the pain? Where it's gone? I mean, that's potentially how powerful that is. And so
And that happens a lot.
it happens a lot. It happens a lot, especially with the people that are kinda, like, pre-screened. Like, I would like to be the place that people start, but unfortunately, everybody does everything else, and then they're like, "Well, got nothing to lose, let's try this." And so, with those people that, you're fairly certain it's emotional, yeah, those transformations are happening all the time like that.
What you said about, because I am somebody that does feel, I feel
Yeah.
it. I know, I mean, I feel everything. It's pretty,
Mhm.
it's how I know, which is why and how I know this work works, because I feel it in action in real time. And
Yeah.
it does feel, and maybe I'm more attuned to it, I don't know, but it does feel exactly like redistributing resources and energy to where it ideally needs to go. It's been diverting,
Mhm.
like, keep you from actually having that full, like, you know,
Mhm.
experience.
Mhm.
A lot of times, because the emotions, unbeknownst to us, this happens often subconsciously,
Yep.
like, "Oh, that's something I don't wanna feel. That's grief. I don't want to invite that in."
Mhm. Absolutely.
And with the idea that is kind of, I guess, what I want people to learn is that inviting it in is what helps facilitate its release.
Absolutely. It's scary. Like the first time you say, "Okay, I've had enough. I'm just going to look in the mirror. I'm just going to look this in the eyes and be like, you're done." It is so I'm getting emotional because I did that. It was just like, keep trucking, keep doing it, keep doing it. And when you're finally just like, look, I've had it. I'm done. I'm going to look you in the eye, whatever darkness there is. I'm looking at it and I'm going to address it. Ooh, that is when transformation happens. Absolutely. Yeah.
It's so scary, and then in hindsight, and almost immediately after you're
Yeah.
processed it, it's, like, not scary, the least scary thing in the world because it's
Absolutely.
done, you're on the other side of it, and it's just emotions keeping you away from it. It's not a physical necessarily a thing.
Yeah.
It may have been, but it is not now, and it's, like, allowing us the ability and, so grateful for these modalities that are teaching us, the way forward and through this stuff,
Yeah.
because
Well, I mean, I think that the physical is very important. Um, but emotional stuff can keep you from making money. It can keep you from having good relationships. I mean, if you're constantly triggered by your partner, I mean, just talking about this male female dynamic, if you're not feeling safe in that role. I mean, I've had so many people come to me and they're like, I've been to therapy. We're doing our tools. We're doing all this stuff. Like, I've forgiven my partner for whatever wrongs have been committed, but why is it still replaying in my mind over and over? Like, I've forgiven them. We've worked on it. We're good, but I can't let it go. I can't let it go. It'll just pop up out of nowhere. Here comes the trigger. And so, addressing the emotional stuff too can like get rid of some of these mental triggers that are holding you back. Because again, that nervous system was threatened by that behavior. So you can cognitively think your way around it and communicate better and do whatever tool. And I think you should. You have to. You have to do that. But that subconscious piece, unless that gets shut off, I mean, you're going to continue to repeat the same issue outside of just physical symptoms. You'll repeat the same story. I mean, how many times do we have people that are, you know, they go through a relationship, they go through a breakup. They're like, okay, well, that person was an alcoholic and, not a good person. And I met them at a bar. And then after they go through the divorce or whatever situation, where are they back in? They're back into the bar looking for the next person. They're looking for a way to repeat the scenario and find a different way out, but they can't. Their nervous system just wants to repeat that over and over because that's where it feels safe. And so you can use NET as a very powerful tool to remove those threats and not repeat the same cycles over and over outside of just your physical body. It was really exciting.
yes, psychology says, like, 95% of our life is run by the subconscious programming, and so this work is really, diving into the subconscious programming and
Absolutely.
optimizing that subconscious program that's directing it's like the iceberg underneath the water.
Absolutely. And you don't have control over it. Like, I hope people feel like
Yeah.
hope that you're not supposed to be able to figure that out. Like, it is subconscious. You need help. You need direction. You're not gonna just wake up and be like, yeah, this is what's going on with me. No, you need some help to figure it out.
You
We all
need
do.
we all need help, we all need each other,
We do.
and that's what we wanna convey, so that, uh,
Absolutely.
this work is, like, available, it's so freeing, it is, freeing to the mind and the body. And that's what your clinic is called, right?
Mind body healing. Yeah.
Mind body healing. Because, yeah, the emotional body bridges, like the emotional body is not separate from the physical body, but
Right.
it's, uh,
Right.
and- but it's, and so this work brings it into unison, into harmony.
Yeah. Oh,
Hi, welcome, Christina.
hi.
Hi. Sorry, I have to go. I thought this started at 9 and then it didn't come up on my
Yeah, no, it
book.
didn't. I'm trying to use a new streaming software and it's just a failure every time. So once I figure it out, but yeah, we're going to be we're doing it on Zoom and I'll post it later.
Yeah.
Okay. 'Cause I
But
gotta
yeah,
run. I have rehearsal for another murder mystery
oh boy,
in theater.
Awesome.
amazing.
All right. Bye.
Hi.
Thanks.
It's so funny.
I love it.
That's a sentence you don't hear every day.
No,
A rehearsal for murder mystery.
yeah, at 9 a.m.
Yes. That's awesome.
That's the life in Baja California.
There you go.
Um, so the body, yes, I think we've said all the things we need to say, though.
Yeah.
Emotional repression causes symptoms that you might be trying to get rid of, won't go away, and so might might try one of these new ways to look at the emotional body and release what's trapped in there. Um,
Yeah.
you're in Daytona Beach.
I'm in Daytona Beach. Yes, I see clients in person there. And then I also do mind body technique via telehealth as well. So I have clients all over the country that I do that work with too, with very, very similar results. So that's really exciting too.
Yeah, I think there's a live we should cook up about the quantum aspect of
Ooh.
work.
Yes, absolutely. I was talking with a chiropractic student. There's a group of chiropractic students that go to Palmer in Florida, and they invite me to speak to them once a trimester. And so I'm really excited about that. But I think I've gone 4 times, and I was having this discussion with one of the chiropractic students, and um, somebody asked me something about I can't even remember the question, but something about like making sense of this. And the student just answered the other student was just like, "It's just quantum physics. Like, it makes all the sense in the world." I'm like, "It's just quantum physics. That's all it is." But I mean, it really does make sense when you get into that realm. Everything makes sense if you can make sense of it. That's the key.
Health makes total sense. You look
100%.
from a quantum physics. Well, the body
Absolutely.
makes total sense, and all these things that we can't figure out if you just look at. But yeah, so
Mhm.
that's what we're here and trying to develop the language to talk about it. It's challenging quantum physics, but we are quantum beings,
Absolutely.
quantum
Absolutely.
physical beings. So it's
Yeah.
a greater understanding of ourselves we're coming into,
Yeah.
and that's how we manifest, great health, great life, all the things.
Absolutely. Now that would be an interesting discussion. That's a talent to take that kind of a concept and bring it to a paradigm that exists in our country. The very mechanistic medical, you know, paradigm. Um, so we should take on the challenge and because that is I mean truly transformative right there. So we should have that conversation.
Yes. I'm trying to do it all the time in my private group
Yeah.
because it's, where because I think I mean, this is the future of health is understanding frequency and vibration and the quantum healing aspect, which we can all feel
Absolutely.
from our homes. And, it's powerful stuff and I love it. It's my passion. So I
Oh,
definitely
it's
have to
so
do
good.
it.
It's giving me that feeling. Oh, so exciting.
Yeah.
I love it. It's so exciting.
Well, this is our first first convo, and then yeah, regrouping and diving down deeper. Um, but
Thank you
yes,
for thank you for having this conversation with me today. It really means so much to me. I'm so excited to just collaborate with you and everybody in this space. Like you said, there's something happening in this area or in this space. I've had conversations with people from Italy and from one from Hawaii recently. So I don't think it's really region specific, but it is region specific as well.
well, it's
Um,
really unique what you are doing, in fact, because you have a clinical practice. You are using NET solely as an emotional. I mean, you're running one of the real, truly emotional healing clinics out there. So
yeah, I really just niched in. I was
niche
just
in.
like, I didn't want to do this, and I felt guilty about it for some years. And then I was just like, I just think I just want to do what really just lights my soul on fire, and that's what it is. And so, but yeah, I do recognize that that is, a bit unique, especially from a business perspective. Like the more services you offer, obviously, the more clients you'll attract. So I'm just like, this is what it is. I just want to be the best at what that is because that's what's lighting me up right now. So
I'm so glad. No, I'm so glad you followed that light, and I understand. Even like feeling guilty about following, like what's that
um,
about? But it's because we're breaking the mold and we're doing what we're called to do, and it has a very important place in the world. And so, congratulations, thank you on arriving, and
same
um,
to you.
yeah,
Mm,
keep doing what you're doing, and find a Dr. Bree in Daytona and online.
absolutely. Yeah, absolutely. So thank you so much.
Yes, and thank you for being a resource, and we'll be visiting again soon.
Absolutely. I can't wait.
All right, take care.
You too.